Hi everyone, this is Dr. Stefan. Today I'd like to discuss with you about pulmonary fibrosis treatments, or why someone may choose not to take the treatment available. First of all, pulmonary fibrosis is a very generic term which refers to scarring of the lungs. This can be caused by various conditions. We generally call these interstitial lung diseases. Some of them can be fibrotic or leading to scarring of the lungs. It's a fairly complex terminology, but we have in the moment of 2023, in the summer of 2023, we have two medications available for a condition which is called idiopathic pulmonary fibrosis, which is a type of interstitial lung disease. These medications are called pirfenidone and nintedanib. No need to remember the names at this point, or you may have heard of them already if you're watching this video anyway. And then for all other forms of pulmonary fibrosis, so lung scarring, which is progressive, which goes on to make the lungs harder and harder over time, we only have nintedanib available, which has been approved for this indication. So we have these medications available. Both medications act by slowing down the scarring process. So if the scarring of the lungs becomes worse and worse over time, these medications offer a chance to slow that process down. It does not reverse the scarring, unfortunately, but in the long run, it may make a significant difference if you think about 3 years from now, 5 years from now, things like that. So unfortunately, these two medications can have side effects. They can be slightly different for pirfenidone versus nintedanib, but for these reasons, sometimes people balance the risks versus benefits in the quality of life that they may expect going forward, and they choose not to go on the medication. It's very important, though, that if you choose not to go on the medication, that you have appropriate counseling before you make that decision. So you have an informed choice. It's your personal choice at the end of the day if you want to start these drugs, but you should do so if you have all the information available. Try to balance risks versus benefits carefully in your case, thinking about other conditions you may be suffering from, other treatments you may be on, what your plans are for the future in terms of quality of life, trips, things like that. Also, thinking about digestive issues, problems with maintaining a normal weight, things like that. So, all these things should be in there. But generally, the main reasons why people choose not to go on an anti-scarring medication is as follows. So, these are the main reasons that I found in my practice and things that have been mentioned before. So first of all, it's to do with the pulmonary fibrosis not being felt as progressing very quickly, or the patient considering that they are too well to go on a medication that can potentially have side effects. This is reasonable. However, it's important to note that pulmonary fibrosis, which is progressive, can actually make you quite breathless and lead to respiratory failure within a number of years. Now, this can be balanced on life expectancy, which is a very complex and nuanced discussion which needs to be had with your own healthcare provider. I cannot advise you whether the decision to go on medication or not go on medication is the right one. I'm not your doctor. I don't know your case. But it depends on your own circumstances. So many people may choose not to go on medication when they feel that their pulmonary fibrosis is not really getting much worse. Another thing would be quality of life concerns. People may be worried about losing weight if they go on these medications. They may be worried about fatigue, which may prevent them from doing trips or activities they enjoy normally. Significant diarrhea can be a problem with nintedanib, for example. This is one of the side effects of the medication. Doesn't happen for everyone. I can tell you from my own personal practice, some people tolerate it absolutely fine with no digestive issues, but some people can have significant bowel disturbance. With pirfenidone, which is the other medication for idiopathic pulmonary fibrosis, some people develop photosensitivity, so their skin becomes quite sensitive, so they need to wear sun protection, sunblock, SPF 50, all the time, every time they go outside. So this can be significantly challenging for some people who like the outdoors, who like to spend a lot of time. They don't want to use sunblock. Again, it comes down to personal choice. It's not that hard to use the sunblock if it prevents a potential rash that can be quite unsightly and unpleasant and hard to get rid of. But some people choose not to take anything. They don't want to use medication. They don't want to use sunblock. And it's a choice that we need to respect. But as you may see from what I'm saying now, it depends on your own choices, on your own lifestyle, but it's important to get the appropriate counseling from someone who's experienced in prescribing these medications to make sure that the decision to not go on the medication is the right one for you. Balancing always the potential for the fibrosis to get worse over time versus the risk, the theoretical risk of having side effects, because not everyone gets the side effects. I hope this was helpful, and it's just a little perspective from the clinical side, from the practice of dealing with situations like this when treating pulmonary fibrosis. Thank you very much for watching. All the best and good health.